This is Political Radar Pulse with Rhonda Sitnikow, where we explore the issues facing Northeast Wisconsin and beyond with insightful interviews and open discussions.
Hey, all you political junkies, welcome to Political Radar Pulse, the best 30 minutes of unscripted and uncensored political talk you will hear all day. And today is no exception to that. I am joined by Jahnke, who is an Operation Desert Storm veteran and an advocate for people with disabilities. Welcome to the show.
Thank you.
So glad to have you on. I think you have a personal story that is so important right now to share with what's going on with the healthcare debate in this country. And that's exactly how I'd like to start. So give us a little walk through your life and how you ended up where you're at.
Okay, so I am an Operation Desert Storm veteran, but that's not really relevant to how I got here. My entire adult life, I've been employed full-time and had full healthcare coverage with every job I've ever had, from the military to I worked in grocery stores for years. And before this year, the previous 18 years, I worked for Coca-Cola. And so I had healthcare coverage my entire life. About 6 years ago, 9 years ago, we had our son, John. And early on, we could see something was not right. By 18 months, we knew something was off. In hindsight, he was showing symptoms of autism from birth. So then about 6 years ago, I decided to go back to college because I wanted to improve my, open up more opportunities for myself at Coca-Cola. And so I went back to college and I was studying business classes and stuff like that. But then as John grew older, his symptoms of autism created more problems for him. And my wife and I found ourselves advocating more and more for him to get services he needed in school, to get things he needed. And the other thing that came up while we were doing that was we found out that because Coca-Cola was self-insured, they didn't have to, and this isn't just relevant to Coca-Cola, any company that's self-insured.
And can you explain, actually, I'm going to just have you explain to some people what that means when you are self-insured, when your company is self-insured?
So self-insured means that they take care of any costs related to healthcare. But how they normally do it is they'll contract with an insurance company, whether it be United or any of the other healthcare companies that are out there. They'll contract with them to manage the plan. And so they'll manage that plan, but ultimately Coca-Cola is financially responsible for, or whatever company chooses to be self-insured is responsible for any coverage, anything that has to be paid. And so, but when you become self-insured, the regulations change, and there's certain things that don't have to be covered if they're too prohibitive. And I don't know all of the legalese about why that is, but I know ultimately things like autism therapies don't have to be covered because it's too cost prohibitive.
Isn't that amazing?
Yeah. So as a result, my son had to go on Medicaid in order to get those services. And so I, like most people, thought Medicaid was coverage for poorer people, or I guess I really didn't even know what all covered Medicaid, but So
this was your first experience with having to apply for Medicaid?
Yep. And then early on, it's difficult when you have health insurance through your employer and you have Medicaid, because early on, until things are settled, Medicaid doesn't want to cover certain things because they feel the employer's insurance should cover it. The employer doesn't want to cover certain things because they feel Medicaid should cover it. And so as you're working through that process of who's responsible for what, it gets pretty frustrating. And trying to figure that out. Once it's sort of settled, it moves. Once both are aware of what they have to pay for, it kind of moved better. But the other thing that happened at that time, as I was progressing and having to advocate for my son to get Medicaid services, to get school services, to get those kinds of things, I realized that my wife and I would sit in these meetings, and as we advocated for our child, people would tell us, "Oh, your son is so lucky to have you as parents that you can do this for him." And I thought, and I'm sure it was meant as a compliment, and I guess I took it that way a little bit. But to me, it was also, so my son gets services because he has us. If my son didn't have us, he wouldn't get services. And so that didn't seem right to me. That didn't seem okay, because there's lots of people who don't have, there's lots of kids with disabilities who don't have parents.
Right, they don't have a support system like that.
Yeah, they don't have someone, and even if they, many don't come from two-parent families, because divorce rate among parents who have kids with disabilities is higher than normal divorce rates. So then there's that element that you're dealing with. But even if you still have a two-parent household, it's a lot of work. And I've had to reach out to a lot of resources from family to friends to find out information that I didn't know, to figure out how to advocate. And so during this time, my worldview changed. I thought this, whether or not I make it in business isn't really relevant anymore. What I want to do is, can I be an advocate for other people? And if I do that, can I make money doing it? Is this something you can do professionally? And I didn't know, but I thought whether or not I can do it professionally, I wanted to do it personally. So I switched my degree field. I stopped taking business courses. I started taking human development courses, and psychology courses and things like that. And I graduated from UWGB in their adult degree program with it's called an interdisciplinary studies degree, and my focus of study was human development. And then an opportunity came up last year there's a federal grant called Wisconsin Promise. And what that grant is it offers additional services to teens with disabilities. And the goal is to see if we sort of offer enhanced services and help families and teens with disabilities, do we improve their success rate and make them less dependent on government assistance? And so within that, my role is a family advocate. So I meet with youth, with teens and their parents, and I look for ways to help them, whether it be the main part of my job is I teach kids self-advocacy skills. I learn them how I learn them. I teach them how to advocate for themselves and how to ask for services and where to go for those types of services, whether it be their local ADRC or how to ask for student services at a school. And so I do those types of things. And then they also come to me with other concerns. I've helped families with housing. I've helped families, really whatever. I mean, and some of what I do is just help them find resources and then show them how to do it themselves, because in September of 2018, our program ends, and then the Family Advocate Services won't be there anymore. So it's not enough for me to look.
And why is it ending?
Because it's a federal grant.
Okay. And the federal grant is, okay. It's
now,
gone.
whether or not the federal government decides to look at the research from our grant and decide to add these types of positions, that's a separate, they'll have the opportunity to do that. But until the government were to decide to do that, or states, and I don't even know how that would look. I don't know where a family advocate position would fit in.
But that sounds like a very crucial position to have in the community.
I think so, and I hope the research bears it out. I hope the stuff we're studying bears that out, because I do think it's a big thing, and I think getting people engaged and my position, I'm able to meet with them. They don't have to meet with me in an office. I can meet with them in their home. I can meet with them in the community. And when people are more relaxed and in a setting they're comfortable with, they share more with you, and you can find more ways to help them.
Okay, so let's and based on that in the conversation, where we're leading to, these are programs that are in the community that really and truly are, they're crucial. They're deal breakers for some people in their lifetime. And your son has been in programs that has been funded through Medicaid.
Yes.
I know you had said Birth to 3 program.
Yep.
The Katie Beckett waiver.
Yep.
And Children's Long-Term Support Program. And those are all programs that are funded through Medicaid.
And the other thing that people don't realize that's funded through Medicaid is speech therapy and occupational therapy in schools. So if your child needs a speech therapist in school, that's partially funded through Medicaid funds.
Okay, so that it's fair to say there's a lot out there that is literally every day making someone's life better.
Yes.
It's out there.
Yep.
Okay, but it costs money.
Yeah, but surprisingly, I had shared a website that you can share with the viewers or listeners later that it talks about 10 things to know about Medicaid, and it's more affordable. I mean, the Medicaid system covers people at a lower cost per person than private insurance does. So it's not this idea that it's a waste, that it's a wasteful program isn't true. And another thing that when I've talked with local politicians like Congressman Gallagher, one of the things they like to bring up is they want to give states more flexibility. Well, the Medicaid system with waivers has a lot of flexibility. States can get waivers to do different things. In Wisconsin, we have something called the IRIS program, which helps people with disabilities. it puts them in charge of their own care, and they can hire personal care workers. They can hire, they have a budget that they have to stay within, but they're the ones doing the hiring and they're the ones doing the paying. So if they want to pay someone a little more money and have fewer hours, they can do that. And there's family care, which is another program, but not all states have these programs. So there's built-in flexibility for states to do things they want to do. And the Children's Long-Term Supports Waiver is another program where it helps families who, if your child qualifies as what's considered for institutional level care, meaning if there wasn't a community support, your child would be institutionalized.
What does that mean? If there are people that may be listening that do not understand. If your child is institutionalized, what does that look like?
Well, at one time in our history, it looked horrible. I mean, Geraldo Rivera did that piece on, I forget the name of the place that he had shut down, but it can look like people warehoused in buildings where, they just sit around with whatever, hitting their head or yelling and things like that. And I'm sure the places Wisconsin still has 2 hospitals that do that. There used to be 3 and one was shut down a while back. And it can look pretty horrible.
But the reality is your child isn't home with you. Your child would not be.
Yeah, your child would not be. No.
Your child would not be home with you if they were institutionalized. They would be at that hospital.
Yeah, and in our nation's history, that's what we used to do. They used to tell people, you can't handle this. We have a hospital for that. Okay. This is where we take care of those people. And it can digress into a pretty bad place. But beyond that, it's just not, even if it's an ideal situation or something that someone may consider ideal, to me, ideal is the child living with you in the community.
Absolutely.
And the other thing is it's not the most cost-effective way to do it, because the community supports and supporting them within the home is cheaper than institutionalizing them. And especially some people with severe physical disabilities that would possibly end up institutionalized, it would be cheaper to have a personal care worker come into their home and help them get out of bed or help them bathe or help them eat, because those type of things you don't need an MD to do that.
Right. You
don't need an RN to do that. So that can be supported at a more affordable level. Plus, it keeps them in the community, and those programs are the programs that support people in the community aren't required to be covered by Medicaid. Those are optional programs. So Wisconsin chooses to have those optional programs. They don't have to, but they have to provide institutional care if you qualify. So the system is the system isn't perfect, and nobody, I think even people that use it, and there's not necessarily enough money in there to support people in the community at the level they should.
So, and that was my next question. So, and let's move into that, because I think this is really the nuts and bolts of it all. So you have, the need is there, right? The need is not going away. Let's just establish this right now. The need is not going away. So why in the hell would we take $900 billion at the federal level with the American Health Care Act? Why would we take that?
So the argument is that when you talk to and it's not all Republicans, but when you talk to the Republicans in general, is they feel there's waste, and they feel there's waste, fraud, and abuse. And I think if you have any bureaucratic system, there's going to be waste, fraud, and abuse. There's going to be. But what they're proposing is a 25% cut at the federal level. There's not 25% of waste.
Absolutely not.
Nobody can prove there's 25% of waste.
No.
And I think if you start,
you're providing a gas leak right now. That's not wasteful, cutting. That is literally turning the lever, and it's starting to leak out now.
Yep. And the other argument they make is that we don't want to go after your son, or we don't want to target this group. But the fact is, they're not cutting with a scalpel. These aren't precision cuts they're making. It's broad across the board.
Yeah, and you said this prior. You're not unique. You represent millions of parents with children with disabilities.
Well, and that's people don't realize that my story of the fact that even though I had health insurance, and I thought my story was unique when it first happened to me. I thought this isn't real common. Most people don't end up on Medicaid who have full health care. But as I've been exposed and as I go out more into the disability community, I'm not unique. There's lots of people from all levels of income.
I think most of us can say we know someone.
Yeah. And the other thing is that people like to, because the other thing they propose are these, the healthcare savings accounts. And I had someone tell me, there's someone who's doing fairly well for themselves. And they're like, well, I put aside the maximum into my healthcare savings account that I can, and then I pay for my medical costs out of pocket. So that way, if something happens down the road, I'll have this money.
Oh, how nice would that be?
And my argument is you can't save enough money. My son's, his ABA therapy, the in-home therapy he gets, costs $50,000 a year.
Wow.
The job I had previously, that's what I made a year. If every penny I made went toward healthcare, it would barely cover it, let alone, having to pay taxes, having to pay for the insurance that didn't cover my son, rent, food, and that his medical costs are bigger than that. He has to have yearly checkups, he has to have shots and those things. And my son's condition isn't even the most expensive condition you can get out there. When you start talking about having to buy wheelchairs or having to buy elaborate communication devices. So this idea that if you're more responsible and you save money, that you could possibly save enough money.
That's so laughable, because I'm sorry. How many people can save money even to pay, for most people, it's, can I pay my premium or on my bill at this point? I can't even decide which one, I want to screw myself over with first. So it's fair to say that this Medicaid, $900 billion, cutting Medicaid at that level will significantly impact parents of children with disabilities.
It will.
It's impossible that it won't.
And the Congressional Budget Office, when they scored the first bill, even said how that would likely look would be like rationing of care, waiting lists. So I could foresee a situation where you would force someone who has a severe physical disability, who has an aide come in to help them maybe shower or get out of bed and stuff like that. I could see that individual. I could envision a scenario where that individual will decide, you know what, I think maybe I can get myself out of my bed and into my chair on my own, so I won't have them come in for that. Well, then that person could fall and get hurt. And how much money does that cost? So really, this is not something that should make you feel better. There's no way around that. No.
And so moving forward with the conversation, so knowing that there was a healthcare debate happening, and then the House was going to, the House representative was going to vote on this Republican plan. So you actually got together with a group of people to go, and you had been trying to get a hold of Congressman Mike Gallagher, who represents the 8th Congressional District for the United States government for Wisconsin. You actually wanted to have a meeting with him, and tell me about that. So
I'm part of what has been going on. I've become part of different groups, and one of the groups I'm part of is I took a class called Partners in Policymaking. It's a class that's put on by the Board for People with Developmental Disabilities. Mm-hmm. And they sort of teach you how to reach out to legislators and help you get educated on disability issues and stuff like that. And so I had decided through this class, and it just happened to coincide with all this happening, that I wanted to reach out to him. I wanted to get a hold of him. And he was a new congressman, and I thought, well, give him a shot. And his staff was really... I'd met with his staff right away. They took a meeting right away. But anyway, So
wait, back that up. So you wanted to meet with him, and you met with his staff. He sent his staff to you.
Well, so originally when I called to make a meeting, I don't remember if the first time I called, if I asked to meet, I said I wanted to meet with someone, and so they had someone meet with me. But then right after that, I reached out for a meeting with him. So
right.
I guess I don't honestly remember if I asked the first time.
You said you did meet with his staff.
I met with his staff.
What
first.
was that like?
She took notes and listened.
She took notes. Okay.
And she listened to the information I had, and she said some of the talking points that you hear from Republicans about the $22 trillion in debt and the these other issues, and the money has to come from somewhere, and those types. As
you're telling her that my son can't speak.
Yeah.
Okay. Yeah. Okay. And proceed anyway.
Yeah. But But you have to go into it understanding that their platform is built on fiscal responsibility, and so that and that's fine. I understand that, but then it's my
even though they don't understand how much he voted on the bill, he had no idea what it costs. But anyway, continue.
And my job as a parent is to show the human side,
right,
and to demonstrate. And I believe it had an impact. And so when I called later, I think part of having that first meeting with the staff helped. Then when I reached out for another meeting, And then they said, well, we can't schedule one until down the road. I said, well, whatever time, I'll make it work. You tell me the time and I'll make it work. And then they still kind of said, well, it's going to be a while. I said, well, just put something in the books. I want a time, whatever it is. And so the first time I got was that April 29th. And when I got it, it looked like that was going to be after they were going to have a vote. And so I thought, well, it's going to be too late. But I thought, I'm not doing anything. I have this meeting on the books. I'm just going to leave it. And things sort of fell the way they did. And the meeting ended up working out. But it was a lot of work. And then
you met with Congressman Mike Gallagher along with a few other people, right?
Yep. There was a couple local people who with disabilities. And then we talked about there was he had posted the picture, and so the one girl that was with us has CP, and so she was in a wheelchair. And then there was another woman with who had traumatic brain injury, and so we discussed some of that stuff. And he threw out the able-bodied thing about how we want able-bodied people to work, and what the because there's able-bodied people on Medicaid is the argument.
Right on. Oh, okay.
But who defines able-bodied was then the discussion we had with him. How is able-bodied defined?
Because let's back that up. So you meet with him and you're discussing your situation with your son. And where does the able-bodied conversation come into play?
Well, because as we're talking about it, that was when I talked about how he said, there's always this argument, well, we don't want to cut your Medicaid.
Okay.
We want to cut where there's waste.
Okay.
And there's able-bodied people on Medicaid, and so that's the waste we're targeting.
But yet that's not the way the bill works.
No, it's not. And that's what I talk about, where we're not cutting with a scalpel. They're not making precision cuts, and they can't. The way it's done, it's a 25% across the board cut.
Everyone knows that. They're not going into home. I mean, you can't enforce that.
So, but anyway, so that was, so
able-bodied.
So we talked about that argument. Well, how does able-bodied work? Because someone with a traumatic brain injury or someone with PTSD, they may seem like they can work, but they can't. And right now, the way Medicaid is working, and the person that was in our group talked about this, how the Medicaid programs have worked to help her work off of Medicaid. And she is currently working her way off and close to being off of the services because the system works when it's used. I mean, it's sort of scary coming off of it because if something happens and you have a relapse, but there's the ability to work off.
Well, it was a tool for her.
Exactly. And it works the way it should. And so once we cut 25%, will that still be available? Plus, will we target this person because they seem able-bodied? And it seemed to register with him, because then he seemed to backtrack, and then he talked about how veterans with PTSD frequently get labeled the same way.
That was my next question.
And so it seemed to like it clicked, but then I've heard him use that able-bodied argument again since then. So I don't know why there's a disconnect. I don't know why he thinks.
Well, one is a script.
Yep.
I'm sorry. It is.
It is.
And the other one is possibly some humanity, seeping in. And then, oh, that's right. And then we back up. But okay, so he's talking about that. And so you had how many minutes? You said you had 20 minutes, 30 minutes?
So initially the meetings are scheduled for 20 minutes. And normally when you meet with any politician, that's usually the most you're going to get.
Okay.
Whether you meet in their office or wherever you meet.
With a group of people, you get 20 minutes?
Yeah.
So everybody gets like 3.5 minutes?
Yeah, and that's part of what you do when you do it. You plan out what you're each going to say. And so the people that came with the group, I told them, I said, you got 2 minutes, because that way you could end up having, if he responds, or whichever politician, this isn't unique to him. This is sort of how the process works. And so you plan, you do, you come up with your elevator speech, if you will, of how this affects you. And then that gives you a couple minutes to respond. But part of it is also when you meet with them is to make sure you direct the conversation. Because another thing that he brought up and was this, it's called the Oregon experiment, where they did like a study where they tested people who got Medicaid services against people who got no services. And they claimed that the results were the same. And that's sort of what he cited.
God. What?
That their medical results were actually better for people with no coverage at all than with Medicaid coverage. So that was a study he cited. So he brought that study up.
But he's bringing it up to all of these people in the room who literally, women who have, because of Medicaid, have moved on and bettered themselves.
Yes.
Your son and the programs that he's involved in, and the only reason he's not institutionalized is because of those programs. That's what was coming out of his mouth? Yeah,
that was an argument. And so I said, my response was, I wasn't, because at that time we thought we only had 20 minutes. So I'm not going to enter into an argument about a study that I haven't read.
Sure.
So I just asked him, can you send me that study? I'd love to review the
Do you have that
material.
study right now?
I don't have that with me.
Did he send it to you?
Yes, he emailed it to me.
He did?
He did.
And so did you look at it?
I did look at it. And actually, I believe it supports our argument because
It supports your
I
argument.
do. I believe
Okay.
I believe
Okay.
it can be interpreted to support our argument because part of what the study found was that there wasn't enough funding in Medicaid for people to get the level of care they needed, and that Medicaid needed to be more fully funded.
Okay, so I'm just going to ask you your opinion, because obviously we know his disgusting vote. That's just, there's only one way to say what it is.
Well,
There's only one way to say he voted.
He went online and said he voted for a bill he didn't support, and that's the third time he's done that because
Okay,
he
right.
went online and acknowledged on his Facebook page that he didn't support either of the two continuing resolutions that he voted yes for, and that he didn't support that he was hoping the Senate would fix the Affordable Health Care Act bill. And one of the things that he promised us in that meeting, because he wasn't committing on anything, whether he'd vote yes or no on a lot of stuff. But he clearly said more than once, I will not support a bill that doesn't protect people with pre-existing conditions. And I would argue that this bill doesn't.
Okay, and see this is what I just want to say, because I watched Mike Gallagher on his Green Bay media tour through Green Bay. He was at every news station, and I mean, I was waiting for them to ask him what his favorite ice cream flavor was, because it was the most fluffy shit that was thrown at him, and just vague, and just the question of covering pre-existing conditions, protecting. Those are words that really you can stretch, and you can you create your own narrative of what you think about that. But when nobody asked him, will people with pre-existing conditions pay more? That is the question, because that isn't truly what the issue is.
Yeah, and
I'm going to cover you. You're going to pay 30% more of a premium, but I'm still covering you. That is not the same thing at all.
Yeah, and yeah, exactly. But my other problem is he is publicly acknowledged to not supporting, that he wouldn't support a final version of a bill that he voted yes for. That if this bill passed through the Senate, he didn't, because he acknowledged on his Facebook page that the bill needed to be fixed. And my argument would be, why did you vote for a bill that still needed to be fixed?
Because sometimes you...
Well, I know, but I think you have to, he should answer for that. He should be held
somebody
accountable.
needs to ask him that, because but this is the problem, okay, with him. And it should be known that as we talk about him, he has been invited on this show at least 12 times, emailed, phone called, I've texted. I have gone to great lengths, almost to a stalker version, to come on and talk about this. He actually was quoted on Wisconsin Public Radio saying to me, I had called in to talk about healthcare a few months ago, that he was excited to come back to Green Bay on the show because he was on during his campaign to talk about this. I would love to ask him some of these questions. He's not being asked the questions that are necessary to be specific about the decisions he made. He made a decision by voting that way.
Exactly.
To take services. I mean, let's get down. Let's dissect it. He made a decision to take away services for people like your son.
Exactly. And
for single parents who work 3 jobs, who just want to stay alive. That's me. Right? I'm a constituent. You are making decisions on a regular basis to literally remove the lifeline for most people, and yet you're not happy with. It's like such a confusing message, and it makes me wonder how are people going to really receive that?
Yeah, and I think, so my view of the Republican situation is they've made this promise to repeal and replace Obamacare. And I don't think that message was received the way they think it was received. So I think they think it was received that we have to repeal Obamacare and replace it with something else. I think the message voters were sending to them is, we want healthcare fixed, whether it be fixing Obamacare, because even people who support Obamacare is not perfect. I mean, is it better than the system we had before? Absolutely. We can't go back to the system we had before. But I think even proponents of Obamacare would argue it's not perfect.
It's not, but what I think the difference is, and what I think, listening to your story and looking through parts of the bill and hearing what he's saying, the mandate's gone, but if you have a 63-day lapse of coverage, then you're paying a lot more in premiums. So if you're a person with a pre-existing condition that is having you're struggling to work, and now you're struggling to pay for that premium and insurance because, people like Congressman Mike Gallagher, who just took this bill and, blew it up so that I have to pay more by his vote, his decision, then you may not have coverage for a while because you just can't swing the money that you need to do that.
Well, and the other thing is what they're, by doing that, they're creating a mandate anyway, because
that is a mandate. It's just not termed mandate.
Yeah, the only
it's
thing
a penalty.
That people don't, the only way the system works is if everybody buys in. That's the only way the system works. This idea that obviously, when I was 18 till I was in my mid 30s, I paid in far more than I took out. And we all, when you're at a healthy stage, you're going to pay in far more than you take out. And so the only way any system is going to work is if there's buy-in. And I think the way they wrote the bill shows they know that. And so
I have a question. So if a man like Mike Gallagher, let's say he was married, had children, and he is not on the same health care that you and I would be on, right?
Okay.
And he had a child with autism and in the same situation, and he didn't have money to throw around to pay for those things. How does that work? How do these people, because supposedly they may not even get the same health care at the end of this whole entire thing happening. They might not have the same guidelines and the same,
I don't know how it works. I think that's still yet to be answered, and I think that's still yet in the bill. And what does that look like? And I think that's part of it is so if they do these cuts to Medicaid, the state's going to have to make a decision. The state's going to have to decide, because right now the way Medicaid works is it's a 60-40 split. And so the state pays 40% and the federal government pays 60%. So Medicaid funding can ebb and flow with need, the way it's set up right now. When they're talking about per capita caps, they would cap a certain amount that they give to the states. And so that would be attached to a rate of inflation to go up at whatever. And that was a separate argument I had, but I'll get to that in a minute. So
really and truly, he voted, by his vote, he voted to cap your son's lifetime care through Medicaid.
No, I don't know if there's a lifetime cap on there, but per capita cap. There's a yearly cap on the amount the federal government will give the state every year. And so if a state's Medicaid costs go above what would normally be the 60-40 split, once the cap is reached, the state's responsible for everything else.
Mm-hmm. And then we know what Scott Walker's saying about that.
So and states would be forced to either raise taxes, cut services, create wait lists, and so you would be forced into those types of decisions.
And another man, let's go to the states. We're talking about the governor. He made a comment, here's another man besides Mike Gallagher who's making insurance companies really happy. He was saying that he wants to consider seeking a waiver.
Well, he said he'd be open to it. And I think what's going to happen is if this passes, you're going to have insurance company lobbyists attacking the states to get those waivers.
Of course you are.
Right. I think it's going to happen until...
And they're not probably going to pay, throw some money towards your next election if you don't do that. I mean, that's really behind a lot of this.
So, and what the Republicans keep proposing is what's called their high-risk pools. But in reality, that's how Medicaid already works. Medicaid works as a high-risk pool. And it's a cost-effective one. As I stated before, that the per-person costs are lower than... I think the numbers I had said... there's 68 million people enrolled on Medicaid, and the federal government spends $397 billion on Medicaid. That works out to $5,847 a person. Someone may check my math, but...
When you met with Mike Gallagher, did he talk about high-risk pools to you? Did he throw that out there?
Yeah, he said that high-risk pools worked well in Wisconsin, but if you talk to people...
It works so well. I think he needs to Google that personally.
Yeah, if you talk to people, but now that I've been more connected with the disability community, you talk to older people with disabilities who existed under that high-risk pool.
It works really well for insurance companies that want to profit. Exactly. I personally think we should put caps on the profit that they make on each person. Let's do those kind of caps.
Well, it was interesting because he cited something about that. He cited how insurance companies are part of the problem and insurance companies make too much money. It said that. I said, yes. And in Obamacare, there's a mandate about.
He said that to you?
Yeah.
Where has he ever said that publicly?
He said that to me.
I have not seen that
because we talked about how insurance companies then the profits insurance company makes are too huge. I said, yes, and Obamacare addressed that. In Obamacare, it addresses where it has a ratio of how much they have to spend on patient care as opposed to operating costs. Because to me, that's the other problem that I have with all this is it ignores what is really driving the problem, which is overall healthcare costs and how insurance companies are this middleman. So when you set aside money from your paycheck to go for healthcare, you assume that's going to go for healthcare. You don't assume it's going to be to build whatever that new building they're building down near Sheboygan is.
Oh, yeah.
Or these giant buildings. Well, all that money that's building these buildings is money that people have set aside for healthcare. They've created this whole economy, and the argument how
I don't think anybody's arguing really and truly that they're not making enough money. I mean, you don't have to look very far to see that.
No, and so that's my problem is so we're addressing all these other things instead of targeting the actual cost drivers. And so I think
because the cost drivers are lining the pockets of politicians who go to Washington and vote the way that they need to. And that's, I would love to see somebody's campaign finance ledger and see what's in there. I think that'd be an interesting thing to look at.
Because I think the public is pushing for single payer, the way the rest of the world does. Whether that's single payer, whether that's government-run healthcare, however it is. I mean, and it shows here where, like I said, the Medicaid per person cost is lower. When it's operated that way, it's a more efficient system for delivering healthcare.
I really and truly think it just comes down to the insurance companies have a lot of money to throw around, and so they give it to these politicians and they just do what they want them to. How else and why else would you take a bill that you don't know as a fiscal conservative, Mike Gallagher, you don't know what this bill costs, but you're going to say yes to it anyway? Who does that? In that context, let's not even take the human piece out of it. Let's do that. Let's take the human piece out of it. How do you possibly vote for something as a fiscal conservative that you have no idea what it costs? How does he do that?
Exactly. And my other argument is,
why isn't someone asking him that?
So these people have, like Senator Johnson just met with Children's Hospital or one of the bigger hospitals.
Okay, Ron Johnson.
So people like that, people from hospitals or from insurance companies, they have access and they have lobbyists and they have access. So people who receive the services, like myself and my son and others, we have to try to fight to get 20 minutes of time with the politician.
Right.
And so, well, yes, that's the way the system works. I mean, it's to get my story out is really hard. I can't, Mike Gallagher said something about holding town halls at businesses. Well, those businesses generally make a donation to get appearance.
Okay, I'm sorry. I actually heard him say that during a morning newscast, and I laughed out loud.
So how that looks?
We have company town halls. Okay, what you really just said? I go to places that's safe. There's not going to be anybody challenging me, and I know that at least a few people in this room have probably donated to my campaign. Because that's what that is.
Yeah, because I've worked at companies where they've brought in people for town halls, and technically you can ask whatever you want, but you're not going to ask it because it's at work, and they've brought this politician in. You're not going to throw a hardball question at them.
No, it's complete fluffy, softball
because you're going to have fear
experience.
Of employment. Yeah, so
right, but it looks good for the politician, and that's it. It's like I did this. I was there.
But I question. I think they're fooling themselves if they think it really looks good.
Well, that's
because I think most people see right through it.
I think a lot of people see right through it, but you'd be surprised. There are some people out there that just aren't connecting. The lights aren't flickering. So I want to go quickly back to, we're out of time, but to Senator Ron Johnson. So we talk about, you are an advocate for people with disabilities.
Yep.
And Senator Ron Johnson, who is the next person to take this healthcare bill and vote on it, which just makes me so warm and fuzzy. I just can't tell you. That's sarcasm, by the way. He's going to be the person to look at this piece, of this $900 billion cut to Medicaid for people that truly need this. I mean, they need this, and he's going to look at this. But he's also the man who proposed an amendment to the Americans with Disabilities Act to basically give private schools the right to discriminate against disabled children. Who does that?
Oh, we could have a whole separate.
But I mean, seriously, who does that?
Yeah,
what kind of person collects a paycheck from the very people that he's bending over?
Yeah, I don't.
Who does that?
I don't understand that and that's actually the big problem I have when they talk about school vouchers and that whole thing, because my son can't go to those schools.
Of course not.
My son doesn't have that choice.
Right.
But to me, if you're going to accept federal funding, and so that's something that I argue a lot about when we discuss this other subject, is that they should have the same oversight everyone else has. So if you're going to take government money, you should have the same rules apply.
But it's
to
a
you that
private
apply to
business.
public
The
school.
Title II money is what you're referring to, right? The Title II money for school funding.
Yeah.
Yes, and that's where it gets wonky because they're a private business, but the reality is they're still getting funding from the same source. So why aren't you following the same
If
regulations?
you're getting federal government funding to run a
So
school,
I want to ask you
accept
two more
that.
questions before we
Sure.
wrap up. Do you believe that when your group met with the congressman, Mike Gallagher, do you believe that he knew how he was going to vote? Because he wasn't telling people, right? He wasn't saying how he was going to vote on anything. He wasn't answering to that at all.
I genuinely don't think he knew how he was going to vote.
He had no idea.
My personal opinion, and this is just based on things I saw, I think there was political pressure for positions and other things. Because when I talked to him, he wasn't sold on the bill. And I know when we were calling, there was lots of calls.
But he said he wasn't sold on the bill, and he still voted for it.
And that's why I think that's politics.
I'm sorry, that line of comments, his next opponent can go for days with that.
Exactly, and I agree. But I think, I think he was one of those they were targeting to swing. Because when you talked about leading up right to the very end of the vote, they had certain congressmen they were targeting to swing. I think he was one they were targeting because I think he was non-confirmed.
Okay, and my other question, and my last question for you, how does it feel that your congressman, Mike Gallagher, doesn't have your back?
It doesn't feel good. My bigger problem, I don't understand why there's it's more than just him. I don't understand why people don't.
But he is the one.
He's the one who cast
He's
the
the
vote.
one who made the decision to vote on healthcare, the most critical piece of legislation that we will see probably within the Trump administration. However long that goes, that's debatable. But it really and truly is the most critical piece of legislation I believe he'll ever vote on. He doesn't have your back on that.
I feel like he let us down and he lied to us because I would disagree that pre-existing conditions are. And that was the one promise he gave us, is that he wouldn't support a bill that didn't protect pre-existing conditions, and I don't believe this bill. So I feel
and let's get the word protect out, because to protect means it's reasonable in reality for people, and that is absolutely not going to be the case.
Exactly, and so that's what that's my interpretation of it, and I don't know how someone could defend a different interpretation of it, but.
Well, when the insurance company, really needs you to make sure that they can continue to make that money, you're going to say the things you need to say.
Yep.
That's the way it goes. So, I'm so grateful that you came and shared your story. I want you to keep telling that story. I think that, advocating for your son, you're really advocating for many people's children by what you're doing, and it's so important. And I'm so thankful that you are.
Well, thank you for having me.
So this wraps up Political Radar Pulse episode 9. For show notes, go to politicalradarpulse.com/9. If you are watching this episode on YouTube, like, subscribe, and don't forget to hit the bell to get notifications. If you would like to support the show, you can like this show on Facebook and Twitter, and you can buy shirts and other merchandise at politicalradar.com/shop. Thanks for tuning in.
Thank you for watching Political Radar Pulse. To ensure that you'll never miss an episode, subscribe on YouTube or your favorite podcast app. To check out more episodes of Political Radar Pulse, visit politicalradarpulse.com or connect with us on Facebook or Twitter.